thank you for joining us today. We're going to be talking about working with biathletes.
The history of the biathlon began back in the hunter-gatherer period when people started to combine the sport of cross-country skiing with hunting. In the second millennium BC is when you start to see historic findings of the bowman that is drawn into rocks as a hieroglyph. And then the earliest records of skiing for the purpose of hunting specifically is found in Roman, Greek, and Chinese history, so kind of all over the world. In 1949, the biathlon was accepted as an Olympic sport, and then it premiered as an Olympic discipline in 1960.
First off, there's a lot of different types. There's actually 6 different types of biathlons you can participate in. And what you do is you basically are going to be doing cross-country skiing and rifle shooting at the same time. So you're going to be racing as hard as you can, then quickly relaxing, shooting some targets, and then continuing on. So to be a very good biathlete, you need to have a very high aerobic capacity. As you can see here on this chart, looking at Olympic competitions, individuals that had higher VO2 max capabilities were able to get more medals. Though debatable, low back pain in biathletes is the most commonly affected area in the body. Specifically looking at the younger population, lower back pain is extremely prevalent. Though younger individuals have more low back pain, there was a study that demonstrated for individuals that have trained for 7 or more years in the biathlon, they actually also are at higher risk of low back pain as compared to normal biathletes. When comparing an average biathlete versus an elite biathletes tend to have a little bit less injuries, perhaps because of the ability to neuromuscularly plan their movements a little bit better. When you carry your rifle, it'll increase the amount of force and work that you have to do. So that is always a recipe for injury risk. For individuals that are able to produce more work with their upper extremities, their cross-country skiing capability is going to be significantly increased. Another demand in a biathlon is the ability to shoot. Typically, for the standing shooting, that will bring your center of mass a little bit forward, so that puts on increased stress for that supporting arm. So that's something to consider. And then a big thing as far as performance while shooting is the research is showing the frontal plane instability is really the key here. So the frontal plane stability is very important.
So while competing, a biathlete is required to carry their equipment with them through the course. There's a lot of equipment required for an athlete, but there's 2 main categories. So the first category of equipment that a biathlete needs to have is for shooting. The other category of equipment that a biathlete needs is for skiing. So they need their boots, ski poles, skis and wax, and a ski suit. There are 2 main styles of skiing that a cross-country skier uses. So the top picture up there is the classic style. So in the classic style, the cross-country skier is going to keep their skis on the snow the entire time, and just their heel lifts off the actual ski. And that's in contrast to the freestyle method, which is the bottom picture. And so the freestyle method, the skier actually lifts their whole ski off of the ground when they're pushing back. So they push back at an angle and lift that foot back up in order to get the foot back underneath them. So low back pain is a very vague diagnosis, and there's a lot of different things that can contribute to low back pain. So specifically for skiing, there's 2 main categories of low back pain. So that can be a muscle strain or a lumbar sprain. So those are kind of 2 bigger categories that are used to describe low back pain. It's recommended for prevention during winter skiing sports that an athlete maintains a healthy weight. They might choose to use low back support while skiing, and then they should be wearing protective clothing. And those are more recommendations for all cross-country skiers, but biathletes as well.
So there are a lot of outcomes you can use as a physical therapist working with a biathlete. Some of the more common ones are the FPU, the ODI, or Oswestry Disability Index, the LEFS, and numeric pain rating scale. As far as imaging, unless it's severe low back pain, the results for imaging aren't that good. People might have issues in their low back that really aren't adding to the problem that they're currently experiencing. So I would be hesitant to refer all my patients for diagnostic imaging just for low back pain.
Disc herniation is something that you see a little bit more commonly with this athletic population. And this typically comes from increased shearing forces at the lumbar disc that happens with the kick phase of the cross-country skiing. So that kicking back and all of that force generation is really increasing the shear force on your lumbar spine and can predispose this athlete to a disc herniation. Spondylolisthesis is another real complication of this sport. So a study by Alexstrand and Werner in 2006, they actually showed a 13.1 degree increase in lumbar lordosis in young cross-country skiers. But that 13.1 degree increase in lumbar lordosis really shows a structural change in the lumbar spine over a period of 5 years. And then another kind of general low back diagnosis would be mechanical low back pain, but that would be secondary to overuse. A lot of these skiers, they have high training volumes, especially preseason, and then high competition loads during Olympic seasons as well. In addition to a lot of different diagnoses, there's a ton of different surgical procedures that could possibly be used to help treat some of these conditions. So first line of defense is going to be conservative treatment. It takes about 4.7 months for a cross-country skier to return to cross-country skiing after a low back injury. They could undergo a discectomy or microdiscectomy, and this would be to correct a disc herniation. And this would be more for a very severe symptomatic disc herniation. There's an example of Brendan Green. He's a biathlete for Canada, and he herniated his disc warming up for a World Cup race. And then with a discectomy procedure, there's a 10% chance of reherniation within 6 months, and this did happen to Brendan Green, which is unfortunate. And finally, to treat spondylolisthesis, if it's very progressed, grade 3 or 4, an athlete could undergo a decompressive laminectomy or spinal fusion, and this would be to stop that forward slippage of the lumbar vertebrae. So the picture shown on this slide is a discectomy where they actually open up the lumbar spine, whereas a microdiscectomy, they would go in through arthroscopic ports. If your athlete does go the surgical route and they do end up with a discectomy or microdiscectomy, they need to be resting for 6 to 12 weeks before they begin starting their return to play training. And then spinal fusion, they may need to wait up to a year before returning to their sport.
You should understand that a lot of biathletes do have injuries. The majority of them, for their severity, is very low. From data that was produced in the 2010 Winter Olympics, total injuries was actually very, very low. It was one of, if not the lowest sport of injury. However, when you looked at illness, it was actually higher when compared to other sports. There were more illnesses. When looking at specific pathologies present in biathletes, a lot of times muscle strains, herniations, osteoarthritis, there's a lot of different things that could be the blame. At the bottom, there are special tests that you can use to really help narrow in exactly what's causing the issue. When training an athlete that competes in a biathlon, you can still use a treatment-based classification. So this is a relatively new approach. So there are 4 different approaches as far as treatment. First one is manipulation. Second is stabilization. Third is kind of an exercise, a specific exercise, depending on which positions feel good or feel bad. And then also traction is an option.
So in terms of a general plan of care for an athlete with low back pain, you want to look at prevention, stretching, strengthening, and then cardiovascular training as well. So specifically for a biathlete, for prevention, you want to make sure that they are strong, that they are conditioning with proper techniques. And then something specific for cross-country skiers and biathletes is fall prevention and fall training. Stretching, you want to stretch to reduce pain, improve the range of motion. For a biathlete, it's essential that they have full range of motion through their lumbar spine and through their hip flexors in order to get the maximum from their push-off. And strengthening, they need to have proper core strength through their abdominal and paraspinal musculature in order to support the lumbar spine while they're going through their cross-country skiing, and also for that frontal plane stability while they're shooting. And they need to have strong hips and glutes to generate the power they need to get the speed for the cross-country skiing. And then cardiovascular training is going to be a very important portion of the biathlete's training in order to keep up their cardiovascular fitness on the off season, and then also to maximize their power while they're competing.
As far as the APTA practice patterns, pattern 4C, 4D, and 4E are generally going to be what you're going to be focusing on.
Once you've been seeing your athlete for a while and they're no longer in the acute phase of their injury, this is when you want to start thinking about their return to play. So ACSM has some guidelines for return to play. They talk about return to strength. So an athlete needs to have 90 to 95% of their original strength in order to return to their sport. Return to activity, so you're going to start your patient off at 50% of their normal workload and then increase by 10 to 15% per week, depending on how they're responding. So if their symptoms are getting worse, then you need to back off. But if they're making improvements, then you can continue to increase their training load. It's also very important that the athlete has the mental confidence in their ability to do their exercise before they return to play. So if they don't have that mental confidence, then there's a real possibility that they could re-injure themselves because of this lack of confidence. You need to consider the reality of return to play training in the clinic. So ideally, it would be best to go with your athlete to whatever field or wherever they need to do their practicing. So in this case for biathletes, it would be ideal for you to go with them to the snow to watch them cross-country ski. Then finally on the side here is another way to approach return to play training. And so this would be based more on tissue healing time, but it gives you a nice guideline for that return to play training. So for cross-country skiing specifically, there are some sport-specific exercises that you can work with your biathletes. So the first one is working on developing the kick muscles. So that's going to be the top picture on the right-hand side there. You can see how he's really pushing off through that back leg. And this is where the athlete is going to generate most of their power when it comes to cross-country skiing and their speed. You want to work on balance in the race position. So the middle picture kind of shows that period of single limb support. So during cross-country skiing, there is a lot of single limb support, and if the athlete does not have good balance on one leg, then it might be challenging for them to really push through their full range of motion and get the maximum amount of power and speed possible. So the third exercise here is power development through the ski pole. And so this is really working on the tricep strength as well as mid-back strength to utilize those bigger muscle groups to push through the poles and generate more power in this portion of the skiing. In terms of a functional movement assessment, the FMS is something that has a lot of research and is well supported in its use for return to play training and injury screen and injury prevention. So an average score for the FMS for a person aged 20 to 50 is 15. If their score is equal to or less than 14, it puts them at a higher risk for injury. Similarly, the MAT is developed by the Functional Movement Group. And so this is a very similar test, but it just utilizes different equipment. So this is a specialized yoga mat that has very specific measurements on it.
When working with biathletes, a shooting component is very important. Really try to put them in a high pressure situation. Research is showing that when individuals are in a high pressure situation, their ability to control their gaze actually is impaired slightly. So let's kind of replicate that in the clinic the best we can, and you have to use your imagination to do that. Additionally, when looking at kind of military and police recruits, they noted that when individuals were to exercise at a very high intensity and then immediately stop and do target shooting, their target shooting scores were pretty bad. But when they were allowed 10 minutes of rest after exercise, their target scores were pretty good. It's basically a skill. They have to stop what they're doing, very high intense aerobic exercise, relax, calm down, and quickly shoot very accurately. So again, we'll have to implement that for return to sport to really optimize the potential of the athlete.
Many biathletes are going to have common athlete goals in terms of their training. So I found some sport-specific exercise recommendations from the US Biathlete Team training program. They talked about using impulse skiing for endurance training. So impulse skiing is going to be similar to sprint training in runners, where a skier is going to ski as fast and as hard as they possibly can, and they do this for a period of 12 to 15 seconds. And then they give themselves a 2-minute active recovery. The next group of exercises is going to be for muscle action quality. So these are going to be more of your basic strength training exercises. So things like wood chops, squats, lunges, chin-ups, V-ups, deadlifts, stuff like that is all going to help to develop that strength. And then finally, the next section is strength, but this is more for endurance strength, again on skis and roller skis. So they're going to do 20 to 30 sets of 30-second repetitions of their skiing or roller skiing, and they're really focusing on their technique here and their power development as well. So this picture shows an example of a log book for the US Biathlete Team. So they go through and they log each component of the previous slide for each day.